Hello everyone, good morning or good afternoon according to the time of your region. My name is Hani Muhammad from Sudan, representing Team 4, the negative team. Today we will be addressing an important ethical question. Should genomic testing in minors require child assent in addition to parental consent? Genomic testing can diagnose rare disease, predict future health risk, and guide life-saving treatments. But when the patient is a child, who should decide? The affirmative team believes that children must give their assent in addition to parental consent. However, we strongly disagree. We believe that requiring assent can delay care, confuse minors, and undermine the role of parents who are legally and ethically responsible for their child's well-being. In this presentation, we will explain why parental consent is sufficient legally, ethically, and practically, especially in the context of complex medical decisions like genomic testing. Our core argument is this: parents are the legal and moral guidance for their children. They are best positioned to make complex decisions that are in their child's best interest. Requiring formal assent from children adds unnecessary complications to healthcare, especially when the child may not fully understand the implications. Okay, we are going to discuss our constructive arguments. Point 1. Legal and ethical norms. Legally, parent consent is the standard in almost all medical decisions for minors, from surgeries to vaccinations. Genomic testing should not be an exception. It is unfair to treat this area differently when the outcomes can just be as arrogant. Point 2. Cognitive capacity of minors. Children vary greatly in how much they can understand, especially younger ones. Expecting a minor to grasp complex genetic information and make an informed decision is unrealistic. That is why requiring their assent is problematic. Point 3. Critical concerns and delays. If a child says no to testing due to fear or confusion, parents and doctors may be blocked from making critical medical decisions. This could delay a diagnosis or treatment, putting the child's health at risk. Point 4. Parental responsibility and motivation. Parents are not trying to control their children. They are trying to protect them. Most parents do testing not out of curiosity but because they want answers that could save or improve their child's life. Point 5. Emotional and psychological harm. Forcing children to take a part in emotionally complex medical decisions may actually increase their anxiety. A better approach is to explain the situation to them in ways they can understand without demanding formal agreement from them. Okay, this is the constructive arguments of the affirmative team, and we are going to rebut everyone. Legal and ethical. Now let's respond to the affirmative team. They may refer to legal ideas like child competence or the UN Convention on the Right of the Child, but even these frameworks support participation, not for decision making. Parental permission remains central. Best interest and autonomy. The affirmative team may say we should delay testing to protect future autonomy, but in reality, delay may cause harm. Early testing can help both the child and their family. For example, through cascade testing where other relatives can benefit. Trust and trauma. Another claim might be that Assent builds trust and reduces trauma. But the evidence says otherwise. When children are pressured to make serious decisions they do not understand, it can actually cause more stress, not less. Guidelines and consensus. The affirmative team may point to medical guidelines, but let's be clear: guidelines support but do not require child assent. Ultimately, doctors and parents use their judgment. Assent should be encouraged when appropriate, but not mandatory. Okay. In theory, child assent sounds ideal, but in practice it is not always possible or helpful. Parental consent with developmentally appropriate communication balances the child's rights with the need for timely and effective care. Okay, in summary, we show that number one, participation is not the same as decision making. Number two, delays can harm the child. Number three, assent can sometimes cause more stress. Number four, guidelines are flexible, not strict rules. Okay. In conclusion, while child participation in healthcare is important, requiring assent for genomic testing is not the right approach. We have shown that parents are already empowered and motivated to act in their child's best interest. Children often lack the maturity or capacity to make informed decisions. Also, requiring assent can introduce harmful delays, unnecessary stress, and ethical confusion. So let's not confuse ideals with reality. In the real world, timely medical care guided by parents and clinicians save lives. That is why we, as a negative team, believe that parental consent should remain sufficient for genomic testing in minors. And lastly, thank you very much for your attention.